eNCA's Zikhona Tshona is outside the giant Chris Hani Baragwanath Hospital for us in Soweto, and it's the financial crisis first, Zikhona, that I think we should start focusing on, because at every single point healthcare is impacted by a severe shortage of money, but also a mishandling of funds.
And also, Jeremy, people taking the government to task when they feel that they have been mistreated medically. And the Chris Hani Baragwanath Hospital is a big contributor to that. A lot of money that the government has been spending on legal fees in particular are coming from complaints that are coming out of this hospital. We heard at the Life is Dominion arbitration hearing that at some point, government paid an amount of 300,000 Rand per day in legal consultation fees. Jack Bloom from the DA saying that the ward here where women give birth is particularly the one that is worse affected, because there the services are just poor. People are not attended to properly. I was speaking to a gentleman who was walking out of here earlier on saying that from the morning time until about 11 o'clock, there are doctors at this hospital, but from after 11, there seems to be no doctors that are available to look after the patients. So really patients feeling as though the health system, particularly in this province, does not work to the advantage of the poor. Another thing that we learned out of the Life is Dominion arbitration hearings, Jeremy, is that this province population growth is quite fast. A lot of people come to this province, not only from South Africa, but from other parts of Africa, to come and receive medical care. The MEC of Health in the province, Gwen Ramakgopa, saying that also puts a huge strain on their budget. But of course, there's huge mismanagement of funds in this province. We've seen through the Life is Dominion project in particular that there were funds that were allocated to that project that were not properly spent. To this day, we don't know whether money that was meant to be allocated to NGOs, where people died of hunger, where people died because there was no medication, where are those funds? To this day, we still don't know. So certainly a huge concern is the mismanagement of funds and the medical neglect on the part of the health officials in this province.
Zikhona, notwithstanding the scenario that you have just outlined for us, I think we also need to reflect on the fact that Chris Hani Baragwanath is a functioning hospital. It has dedicated doctors and nurses, often working under the most arduous conditions. And for instance, it is well known around the world for some of its units, for instance, fire injury and also trauma injury. So one has to have a degree of respect and, I guess, sympathy for people who are working behind you.
Certainly, Jeremy, a gentleman that I was speaking to who came out of here, says he's been coming to this hospital since last year to receive his treatment, and he says that the attention that he gets from the nurses has been absolutely remarkable. He says he would not be receiving medical care anywhere else. We were expecting to speak to the CEO of this hospital for this crossing, but he says he's in a meeting, and I'm hoping that later on we'll be able to speak to him and get more detail as to the work that this hospital is doing in terms of providing a medical health care to the citizens of not only Johannesburg, as I've mentioned, but also South Africa at large. But a lot of people are also saying that behind these walls, Jeremy, there are long queues. People have to wait long hours to be attended to. So certainly those are things that you want to pose to the CEO. He's a recently appointed CEO, so he has a lot of work to do with. I know that this morning already he was meeting with the MEC of health in the province to see how they can tackle some of the issues that are facing this hospital. It is a very big facility, as you've mentioned, and provides health care to thousands of South Africans.
And he certainly must have one of the toughest jobs in medicine in Africa, if not the world. Zikhona Tshona, thank you for the moment.